So your cervix is going to have to go from here all the way to here. For some, that's going to be as easy as doing the splits. But for others, we're going to have to work up to it. Now, you've already sterilized your curve in boiling water for 8 to 10 minutes. Most pregnant women are naturally lubricated and change their underwear 4 times a day. But if you do need some extra lubrication, you can use what your body is already used to, or a tiny bit of coconut oil just around the end is more than enough. We don't want too much slip because we need the curve to have a good amount of traction to get the desired stretch. So let me introduce you to Silicone Sally. This is your vulva and vagina. Up here at 12 o'clock is your clitoris and your urethra, which is your pee hole. Down here at the bottom, just above your rectal entrance, is the area that we call the perineum. This is the area that we want to remain intact at birth. It's also the area that's most commonly has a tear or where they will do an episiotomy. Avoiding any trauma to this area will help prevent incontinence issues later. We insert the smaller head just to here. Instead of using a pulling down method, it is designed to be used like a can opener. We actually pull up and see how it scoops down into the tissue to apply a stretch. If the curve is uncomfortable against your pubic bone, just angle slightly left or right. When it comes to the tissue at 5 or 7 o'clock, do the same principle. Hook into and then pull across, or in this instance, you can use a pull to the side method. If this is your first time using the product, a great technique to try as just a warm-up and a way to get blood flowing is the swivel. So you're going to just insert in gently and then just start to swing your curve back and forth as a nice little warm-up for those muscles. Another great technique to use is gentle oscillation against the tissue. This can help the muscle calm down if done rhythmically like this. What about the big end of the curve? Ah, yes, the big end of the curve. Well, remember the dilation wheel? The curve isn't so daunting when you need to get to here. We're going to encourage you to try and get to the bigger end by 37 or 38 weeks. Some women go for it right from the beginning, and that's because some actually find the larger end more comfortable because a larger surface area is going to spread the load. Remember, it's this size that likely got you into this pregnancy dilemma. The most popular question I've been asked is, so how hard do I pull or push? And it's a great question. We want to build our tolerance to the sensations that we're going to feel on the day. So if we go back to our splits analogy, if you do the splits in one go and try and hit the ground, those muscles and tissue are going to be very upset with you. But if you practice a little bit more every day over a 5-week period, that's going to be a much better approach for your perineum. We need to be in control of what the pain or stretching sensations are trying to tell us. If we use a 10 scale for pain, 10 being the most pain you know to exist, possibly labor, or 1 being a paper cut, we need you to stay in and around the 6 to 8 range. If you get as high as an 8, we want to employ those other strategies to help downregulate the protective pain messages. These strategies are breathing. Don't let up on the pressure of the curve. Instead, close your eyes, take 4 big deep breaths. See if you can get that feeling below a 5 out of 10 on the pain scale. Then try and apply more pressure to the spot. Again, take more deep breaths. Visualization. You just hit 7 out of 10. I want you to go to your happy place. Maybe it's drinking a pina colada on the beach in Turks. Maybe it's you holding your baby you've just birthed. Or maybe it's you getting the most amazing massage and you've just zenned the F out. Distraction. Remember that wicked Taylor Swift soundtrack you curated? Take a moment and sing along. Distract yourself with the lyrics. Try counting down from 103 by intervals of 7. Or try digging your fingernail into your cuticle bed to cause discomfort in another area. Anything to distract your thoughts away from the sensation at your perineum. Like sports teams that practice different plays for game day, or a distance runner that practices different paces for their race day, perineal massage is just the practice of you understanding what your perineum is capable of for Labor Day. Just remember, there will be some pain and discomfort felt, and it's just part of the process. These pain messages are just your vagina saying, What the hell is going on down here? Why are you stretching us like this? Are we supposed to stretch like that? Holy smokes, this is new. I mean, if your vagina or vulva could talk, that's what it would be telling you during perineal massage. On our website, we have set out a schedule to serve as a guideline to help you get your perineal massage sessions in. Starting at 34 weeks, going all the way to Labor Day, the organization is already done for you, but that's the easy part. If you can practice and improve doing the splits over 5 to 6 weeks, if you follow our schedule, this is going to help improve the capacity your perineum has for Labor Day. Stay tuned for our next video where we go through how to use the curve in postpartum. Remember, it's a product for life, and we're going to go through how to use it as such.